My name is Tara Maving. I'm the Director of Outreach with the Population Health Collaborative. I do have a few housekeeping items before we begin. We will be recording this program. We will also be using the chat box for any comments or questions. Please note that we do have everyone muted and your video is off. So if you do have any comments, questions, put them in the chat box. You also can raise a hand and we can contact you if you do want to ask a question. So I'd like to introduce John Craik, our Executive Director of the Population Health Collaborative and the co-chair of the Live Well Erie Initiative. John?
Good afternoon, everyone, and welcome. This is a very, very exciting afternoon for us, and I hope you all got your Grubhub and you're eating but paying attention at the same time. Friday the 13th, in some cultures that's considered a lucky day, but I don't think anybody's going to consider 2020 a lucky year. So we'll see what we can do with this. But frankly, we've got a lot of good news. So here's the agenda for the afternoon, and thanks again for joining us. Rita Hubbard Robinson is going to kind of explain a little bit what some of the terms that we're going to use today, particularly health equity and health inequity. Dr. Willie Underwood is going to talk quite a bit about the cost of health inequity in the Buffalo-Niagara region, and frankly, the fact that it's impacting all of us, whether we know it or not. And then we're going to shift and make a wonderful shift to see some opportunities of what's happening in other communities and what's possible in this community to turn all that around. Rita's then going to lead all of us in a discussion about where we're going to go as a community, how we can address these issues, and how we can emerge a stronger, better, more equitable, and more prosperous community for everyone. So we're very, very excited, and we do have next steps. This is the beginning of a movement. So if you could go to the next slide, please. Part of the good news is that we have a lot of the right players in place already. So the four groups kind of at the table right now represent people who are able to make investments in the community that can mobilize the community. Frankly, there's a terrific infrastructure and some really, really dedicated, committed people here who can serve as kind of the backbone and the people with the day jobs to advance this work. So that's good. That's a terrific, good start and a great infrastructure. But you are here by design and by specific invitation because you are the people, and I'm talking about the attendees, who can make things happen in Buffalo and Western New York. We need a movement, we need a culture change, we need a sea change, and a number of charitably funded organizations and programs is a good place to start, but it's not where we can stop. We really need the community leadership at the highest levels to put these issues on the radar screen, to get behind them, and to put the wind behind the sails of all the people committed to doing this work. So we are absolutely delighted that you're here. You're going to hear more and more about really the optimism that underpins all of this, because we're confident that with your support and with all of us working together, we really can emerge a stronger community. So at this point, I'd like to introduce Rita Hubbard Robinson. In the interest of time, I'm not going to read her bio. Her bio is included in the packet that we sent you. If you have half an hour or so, you can read about Rita's history of leadership, effective communication or community engagement. She's the founder of a number of things that are good and positive in the community. She created a farmer's market with ECMC, and she is the winner of the prestigious Spotlight on Population Health Lifetime Achievement Award. So if you have some time, read Rita's bio. It's inspiring. She's a wonderful person. So Rita, I'm going to turn that over to you now.
Thank you so much, John. Thank you for your leadership.
Oh, and I'm sorry. I'm so sorry. I forgot something to read. So Tara's going to yell at me. I apologize. I do want to thank the planning committee. So people that you're going to hear from: Rita Hubbard Robinson, Willie Underwood, Dr. Willie Underwood, Dr. Tim Murphy, Pastor George Nicholas, and then people who are not speaking: Brittany Perez from LISC, Caitlin Kratheris and Tara Maving from Population Health Collaborative, and Dr. Tom Schenk. And the last piece of housekeeping is we're asking everybody to please put your name and organization or affiliation in the chat box. So I apologize, Rita. This time I really am turning it over to you.
Well, that's good. Thank you again, John, for your leadership, for being such a collegial member of the team. We're just really glad to be able to provide this wonderful opportunity to our participants. Thank you all for being here with us today. I just wanted to go to the next slide and talk a little bit about some of the space in which we work. And one of the areas that we focus on are the social determinants of health. And really what those are the things that are underpinning the actual health outcomes that we are experiencing in our region, in our city. And this is a graphic design that actually give you some clarity around what that means. And often when you say health, people think healthcare, but really healthcare only has a 20% impact of your overall health. And if you look at the feet of the individual that's before you, you can kind of see that visually, that really that's just a modicum of the area of your life that will produce health. So if you think about it, healthcare is sort of sick care in our vernacular, in which case your screenings, your annual visits, all of those kinds of preventative activity really relate to your overall health. But generally, healthcare is considered activated in your life when you are actually not well. So what are the things that are actually contribute to your overall health? Well, they're your behaviors. And many of the team members here, and this is a space in which we do a lot of this work, Population Health Collaborative, the University of Buffalo, the Center for Health Equity, we all really focus a lot of our efforts around health behaviors. But really, this only still has about a 30% impact of your overall health. What are the things that are going to drive your actual health outcomes? Your physical environment, while it's only 10% of your health factor, when you think about it, if you live in the right area and you have the right neighborhood, you might feel more at ease. You might have less crime. You might have easy access to grocery stores. You might have an ability to jog, which all of these things have sort of an impact on one another when you think about it. Even physical environment can drive the right health behaviors. So while it's only 10% of your overall health, it actually activates a great deal of your health behaviors. And your socioeconomics, again, fold into your health and your health outcomes. You see in this graphic, it's the shoulders to the head, if you will. And it's really your brain trust, your education, your job status, your family and support, and your incomes and other community safeties and supports. And when you think about it, your socioeconomics might drive your physical environment and your health behaviors. And this is the space that we spend a lot of time thinking about and talking about at the African American Health Equity Task Force, the Buffalo Center for Health Equity, the Population Health Collaborative, and the Live Well activities in our region, in our county, and also at the UB Community Health Equity Research Institute. Next slide, please. Also, we talk a lot about equity and not equality. If you look at this graphic, you see something that we like to do in Western New York, we pick apples, right? So here you have an apple picking graphic. And if you look at the issue of health in the lens of equality, everybody gets the same thing. Everybody gets the same little step stool to stand on. And if you're too short, guess what? You'll never be able to reach the apple. You'll never be able to reach toward health. So the underpinning of the socioeconomics, the social determinants of health, and the ability to see the work that we do in a way that promotes equity, not equality, are some of the underpinnings of the work that we are invested in. And so if you are already able, strong, whether you have a good job and so on, maybe you only need one step stool, and maybe you have a good education and perhaps need some opportunities, you get 2 step stools. And then if you're really sort of on the lower rung of the economy and you have less access to education and other things, you might need 3 step stools. And that is a description of equity. When we talk about health equity, that's what we're talking about. Not everybody getting the same thing, but everyone getting what they need. So with that, I would like to introduce our next speaker. He's a wonderful leader himself. He is the director of the Buffalo Center for Health Equity. He has more than 20 years experience in healthcare, and he is a scientist, a clinical scientist, an entrepreneur, a social agent. He's dedicated his career to addressing health inequities amongst men with prostate cancer. And he's also known nationally for his involvement in healthcare policy and legislation. Currently, he is a member of the Board of Trustees of the American Medical Association, Board of Directors of Health Now, member of the Board of Population Health Collaborative of Western New York, and co-host of our own show, our radio show here in the city of Buffalo, Igniting Hope Radio. With that, I'd like to introduce Dr. Willie Underwood III. Thank you so much.
Oh, thank you very much. And I thank everyone for joining us today for the program. And Rita, awesome introduction, and thank you for all the work that you're doing. Next slide, please. When we look, so what do we know about the state of health in Buffalo and Erie County, especially among Blacks? This is a report that's put out every 2 years within the county. It's the county health assessment done by our county commissioner, Dr. Gail Bernstein, and our current county exec, Mark Poland. Next, please. And here are some of the contributors to it. Next slide, please. When we look at Erie County is the region. We know that the population in 2015 was a little over 900,000. We know that 20% were under age 18, 16% over 65, 38% Black, and 10% Hispanic. Next. Buffalo has a higher percentage of Blacks compared to Erie County. Next. When we look at premature causes of death, we know cancer, heart disease, unintentional injuries, chronic lower respiratory disease, and diabetes are in our top 5. Next. Cardiovascular disease is the second leading cause of death in Erie County. Rates of stroke death in this region are higher than the national rates and nearly 16% higher than the aggregate New York State rates. And Erie County residents experience 33% more heart disease deaths than the U.S. average. This is significantly influenced by race and income. Next. When we look at mortality and racial disparities in Erie County, heart disease, look at heart disease mortalities due to economic inequalities, you see a significant overlap. Next. Look at the higher hospital congestive heart failure rates in Erie County, and among those, higher percentages, higher percent are Black. Erie County congestive heart failure hospital rates per 10,000. We see Erie County is higher than New York State and the U.S. And we look at the racial background on the slide to the right, we see that 47% of those are Black, which is higher than the percentage of Blacks in the region. Next. Look at diabetes hospitalization rates per 10,000. We see higher significant impact in the African American community, the next in the Hispanic community, the next whites and Asians being the lowest. So the highest proportion are Black. Next. When we, the higher proportion of cases, when we look at cancer cases, the higher proportion of cases are diagnosed in Buffalo and within and with late stage disease. As everyone knows, if you're diagnosed with late stage cancer, it significantly reduces the likelihood of being cured of the disease and also lowers your life expectancy. Next. Next. So when we look at household income and education in Erie County, we see that Buffalo has lower high school graduation rates and lower percent of those who have college degrees. And that impacts, and you say, lower household income as well between 2011 and 2015, comparing Buffalo to Erie County and to New York State. Next. The median household income of Buffalo residents are 62% of that of the rest of Erie County and 54% of that. And I'm sure that race and gender, New York State and race and gender has a major factor driving these disparities. Next. Look at social determinants of health and health disparities. 70% of the Erie County Department of Health clinic patients comes from 5 zip codes within Buffalo. 14204, 06, 11, 12, and 15. Unemployment is sniffing higher in these zip codes than in the rest of the county, New York State, and the nation. Median household income, per capita income, are about half of that of Erie County level in 3 of the 5 zip codes. Race and ethnicity distributions are also very different in these zip codes compared to the rest of Erie County, the state, and even national percentages. Next. Disparities in the community, whether we look at race, ethnicity, education, socioeconomic status, are all evidence within these zip codes. As expected, health outcomes are significantly poorer than those in the county as a whole. As an example, 2015 zip code has significantly higher poverty rates and is primarily composed of higher percentage of Blacks than are found in other areas of the city of Buffalo and in Erie County. When we look at the preventive quality indicators for 2015 zip code, hospital admissions are 150% higher than expected. Hospital admissions for Blacks are 210% higher, while those for whites are 55% higher of what is expected for this population. Next. It's a great report that was done by published in Health Affairs in 2018. I'm going to give some information from the summary. Income is strongly associated with morbidity and mortality across income distributions, and income-related health disparities appear to be growing over time. Income influence of health and longevity through various clinical, behavioral, social, and environmental mechanisms. Isolating the unique contributions of income and health can be difficult because of the relationship of intersection between other social risk factors. Poor health also contributes to reduced income, creating a negative feedback loop that's sometimes referred to as the health poverty trap. Income inequalities have grown substantially in recent decades, which may perpetuate and exacerbate health disparities. Policies initiatives that supplement income and improve educational opportunity, housing prospects, social mobility, particularly in childhood, can reduce poverty and lead to downstream health effects, not only for lower income people, but also for those of middle class. Next. The unique role of race. Race is strongly influenced other socioeconomic factors, including income. Black Americans continue to have both lower income and shorter life expectancy than do whites, even when they have the same education and the same jobs. There are also many reasons for racial health disparities, but the literature has suggested that the central role is played by chronic financial hardship caused by centuries of exploitation, segregation, as well as the direct toxic effects of discrimination on mental and physical health. Next. Even today, access to education, credit, economic opportunities, and healthy environments varies across races. The relationship between race, income, and health persists both within and across races. Low-income Black Americans live shorter lives than those of high-income Black Americans, and affluent Blacks die earlier than affluent whites, think. Next. As Martin Luther King said, we are caught in an inescapable network of mutuality, tied in the single garment of destiny. Whatever affects one directly affects us all indirectly. Next slide. And this is why we should care. When we look at the economic burden of health inequalities in the United States, it was estimated by Levisonos in 2009 that the estimated income burden of health disparities in the United States, look at three measures: direct medical costs, health inequalities, and indirect costs of health inequalities, and the cost of premature deaths. Next. Between 2003 and 2006, when they looked at the data, the combined cost of health inequalities and premature deaths in the United States was $1.2 trillion. Eliminating health disparities for minorities would have reduced direct medical cost expenditures by $229.4 billion for the years of 2003 to 2006. Between 2003 and 2006, 30% of direct medical care expenditures for African American, Asian, and Hispanics were excess costs due to health inequalities. Next. Eliminating health inequalities for minority would have reduced indirect costs associated with illness and premature deaths by more than $1 trillion between the 3-year period study 2003 to 2006. Next. The economic impact. Look at the poor health in Western New York community. We see the contributors to the side. And the population report, I don't know if it's been released yet, but this is through the Population Health Collaborative. Next. So this is background on how the study was designed so we can put it in context. Look at a peer group. They looked at peer groups of 10 metro areas and measuring similar demographics and socioeconomic factors. The Buffalo Niagara has compared mix of diversity and peer with a mix of 78% non-Hispanic whites and 12% blacks. The population of peer cities range from over 650,000 to 2.3 million, and a Buffalo Niagara in between a population of 1.1 million. Next. Comparative data, Buffalo Niagara key health measures. When we look at the chronic conditions of health behaviors potentially involving significant healthcare utilization and expenditures for inpatient, outpatient, prescription drug care for the workforce, the area ranks below the national average. 10 out of 12 of the chronic conditions of health behaviors, hypertension, asthma, chronic obstructive pulmonary disease, diabetes, non-skin cancers, heart attacks, and adult obesity, high stress physical activity, and smoking. Buffalo Niagara rank well and relatively low. We're looking for strokes and depression prevalence. Next. Just so that we can see what this looks like in the graph, we see next. Asthma, we're at the bottom. Cancer, we're at the bottom. Moderate for COPD, and okay for depression. Now, none of these indicators where you actually look at it that we're actually good. Next. Diabetes, bottom. Heart attack, bottom. Hypertension, bottom. The worst. These are things that we ought to consider. Yes, we're good for stroke. Let's clap for our stroke center. Next. And these are prevalence, not actually truly the outcomes. Now, what is the cost of these conditions on our economic stability, our economic outcome? We see them on the right. That's significant. But the most thing is this, is that the cost of productivity is $1.2 billion annually. Next. When we look at impact on Buffalo Niagara, the total increment medical costs for asthma, breast and lung, COPD, depression and diabetes, hypertension, and stroke is $1.3 billion. The economic productivity costs exceeded $1.2 billion annually for chronic conditions. This is a total cost of $2.5 billion, representing 4.2% of the Buffalo Niagara 2017 gross domestic product. Next. You can spend your whole life believing that you can't change things that you don't like. The day you see that for a lie, anything is possible. Sheridan Pierce. And just by the way, she was on the show, my 600-pound life, and she weighed 778 pounds. But once she realized that what she believed to be true, it was a lie, then anything was possible. Next. We can no longer afford to ignore health inequities in this region, especially in the Buffalo East Side. Now is the time to work together to attack this 2.5 billion annually cost drain to our region. Together, if we use our resources, intellectual and financially, in an equitable, inclusive, and anti-racist way, we can revitalize this region economically by making it one of the healthiest regions in the country. And in doing so, local businesses will experience increased economic productivity and lower healthcare costs. Next. Thank you. I hope you found this presentation to be educational and enlightening. I return it.
Thank you so much, Dr. Underwood. That was very important information, and it helps to center our discussion today, our panel presentation that will be taking place after the coming video, and really just helping our friends on the call, on the Zoom, to really get why we're saying that health equity can promote financial equity in our region. With that, I'd like to sort of just give you a little bit of a background about the video that you're about to see. It's about 3 minutes long. And what we're going to look at here is an example of what we can do in a corporate community to drive community development in such a way that it has an impact on the health of our community. So we're just really excited to share this with you. Again, we want to underscore that it is an example and that there are a lot of examples, some of which will be raised in our panel discussion, but there'll be others that we might even be able to create amongst ourselves in our coming activities with this group. So with that, if we could tee up the video, and we'll see you on the other side. Thank you so much.
Like many American cities, Cleveland was once a center for industry and good jobs. But the factories closed up or moved away and took the jobs with them. Today, over half the children in Cleveland live below the poverty line. Without jobs, poor neighborhoods get poorer, and disinvestment, lack of educational opportunity, and barriers to employment compound themselves. How can we bring jobs back to cities like Cleveland and keep them there? We need to work with what we've got, and a city like Cleveland has got a lot of world-class hospitals and universities. These are anchor institutions, large, non-profit institutions which are anchored to the city and very unlikely to move away. These anchors are the economic powerhouses of the city, spending billions of dollars every year on the goods and services they use every day. But a lot of that money is spent far outside the city. How can we use the billions of dollars anchors already spend to help lift neighboring communities out of poverty? The Cleveland model points toward a solution. Anchor institutions want to make their operations more sustainable, and this is an opportunity to create new local businesses to fill these new needs. But we need to make sure that these businesses stay rooted in the communities that need the jobs the most. In the Cleveland model, these businesses are worker cooperatives, owned by their own workers. Each worker owner has an equal share and a voice in the way the company is run. Democratic control of the company keeps jobs local. It's hard to imagine the workers at a company voting to eliminate their own jobs because it'd be cheaper to hire lower-paid employees somewhere else. And democratic ownership of the company keeps the profits local too. Rather than flowing out of the city to an owner in the suburbs or to some big corporation's offshore bank account, the wealth generated by the business is distributed broadly to the community members whose work makes that wealth possible. Keeping wealth local means that more people can buy more things in the community, which creates more jobs and builds more wealth. The anchor institutions buy things like clean power and local produce from the cooperatives. This was money they needed to spend anyway, but now they not only get the sustainable goods and services they need, they are also helping build jobs in their neighboring communities. And when the cooperatives have long-term contracts to supply major local institutions, they can be more certain that their businesses will thrive. They can even take these contracts to the bank if they need credit to help their business grow. It's a win-win situation. These cooperatives themselves cooperate. They are linked together by a larger nonprofit. The worker owners promise never to sell their company to make a quick buck, and in return, the nonprofit helps their cooperative business succeed, providing technical assistance and strategic guidance. The nonprofit also operates a revolving loan fund, which channels investment from anchor institutions, local foundations, and government programs to the cooperatives. As the cooperatives thrive, they pay back into the revolving fund, which eventually provides the money to help launch yet new cooperatives, creating even more jobs. If it can work in Cleveland, it can work in your city. With cooperatives in Cleveland operating the nation's largest urban greenhouse and installing its largest urban solar field, people are paying attention. The Cleveland model is spreading, with worker co-ops connected to their local anchor institutions springing up in cities across the country.
Thank you so much to our tech crew. Thank you for pulling that up. We appreciate all your work and getting all of these pieces together for today's presentation. We did not think it robbery to talk a little bit about Cleveland in this video, because Cleveland does have a lot of similarities to our own Buffalo, and wanted to note that cooperatives are just one example of things that we might think about. But that we really wanted to inspire you to think about big ideas. It's great, as John said earlier in the presentation, to provide charity and sponsor programs and those kinds of things. That's not what we're talking about here. We are talking about big ideas that can be innovative, that can create change, that can create culture of health, and that you will all be able to participate in for a legacy for our city and our region. With that, we are going to now introduce our own local champion in this space, Julie Barrett O'Neill. She is the executive director, and she joined the LISC organization in the September of 2018. She is an attorney by trade and an urban planner with over 20 years of experience working in community revitalization. She is a colleague. She's also very passionate about change, and really I'm glad that she was able to ferret out a little time to be with us and to be our moderator of the next panel presentation with our next esteemed guests. And with that, I'm going to turn it over to Julie, who will introduce our guests, panelists, and help with the interview of that section of our day. Thank you so much.
Thank you so much to Rita, John, and all of the individuals who were part of organizing today's events. It is really an honor and a privilege to be able to work in such close partnership with each of you. As Rita mentioned, my name is Julie Barrett O'Neill, and as a proud Buffalo native, I was honored when Maurice offered me the opportunity to come and serve in this role in Western New York. He is a phenomenally ambitious leader, and it's not often in our career when we have somebody sit us down and then send us follow-up text messages, making us promise to think big and do bold work in service of our community. And so it's been a tremendous opportunity to work with an organization organization with such tremendous muscle and resources and a long track record of success in delivering on behalf of local communities. LISC, if you haven't worked with us before, is our name is Local Initiative Support Corporation. And we're part of one of the nation's largest community and economic development organizations. And we work to link neighborhoods and individuals with the tools they need to thrive. At our core, we are a community development financial institution that makes investments to help transform neighborhoods that have traditionally not had the support they needed. In January of this year, we launched an ambitious 5-year strategic plan with the support of our local advisory committee, and that was based on tremendous input from a wide range of stakeholders over the 2019 planning period. That plan is designed to address many of the racial equity, income, health, and wealth disparities within our community through strategic investments in neighborhood revitalization, affordable housing, family income and wealth building, and inclusive entrepreneurship. And it's in that capacity and through that work that I have the distinct pleasure of working with LISC's CEO and the National LISC team, as well as Tony Davis, the Community Engagement Director for the Federal Reserve of New York. We've asked each of them, their bios, like the previous speakers, are included in your briefing packet because it's much more interesting to hear from their experiences and presentations during this brief time we have together. They will each provide a quick introduction, and then we will have a little bit of a facilitated conversation, followed by some flexible time for questions and answers from our guests. I would encourage each of you to provide any questions you may have to the chat. We have pulled in 2 of LISC's national health and community development experts, Julia Ryan and Daniela Lewis, on the chat to help us with our responses so that we can provide the most detailed information to you. And with that, I'm going to introduce Maurice Jones, our esteemed CEO, to share some large-scale thoughts on LISC's work in this area. Maurice?
Well, good afternoon to Buffalo. Can you hear me okay? Give me the thumbs up, Julie, if you can hear me. All right, great. It is nice to be with you all, and let me start by just saying my thoughts and prayers are with you all as we continue to fight multiple pandemics in Buffalo as well as elsewhere across the country. And I look forward to the time that I can actually be with you in person. But I'm grateful for the chance to be able to share with you via this technological revolution that we're going through right now. LISC is in the opportunity business, pure and simple. What we try to do is to use tools like grants and loans and equity investments and tax credits and technical assistance and community organizing to create sustainable, inclusive, and diverse and growing communities that are open and accessible to all, and communities that are making progress on all fronts. In this day and age, I wanted to just lay out 3 or 4 things that we're really focusing on, and then hopefully we can talk more about this in the facilitated discussion. We're living, as you know, in multiple pandemics, a health pandemic, a pandemic related to the recession, and a racial reckoning. And what we're seeing around the country is incredible partnerships coming together, public-private and private-private, to work on a handful of things to make sure that our communities can both weather this storm, rebuild greater, and reposition for the future. One is helping folks to really pursue wealth strategies, really focusing on Black and brown communities, really focusing on low wealth communities, really focusing on helping folks with home ownership opportunities and small business ownership opportunities. I hope we can talk more about that. Secondly, we see private partnerships, public-private partnerships, philanthropic partnerships with the corporate sectors around helping individuals build their credit or rebuild their credit and get access to capital, really focusing on the unbanked and the underbanked. Lots of good work going on there. Thirdly, we're seeing some tremendous work, and we're in some tremendous partnerships around quality jobs with a real focus in trying to close the wage gaps that you were talking about. And so really trying to leverage capital to invest in companies that are providing good quality jobs with benefits to low wealth communities or individuals living in low wealth communities and Black folks and other people of color. And then lastly, we see a lot of work being done focusing on the assets that you need in order to really promote health, promote wealth, and promote opportunity amongst the underinvested, amongst Black buffaloes, Buffaloans, if that's the right word, and others. And that's, schools, that's arts, that's broadband access, that's healthcare, that's definitely commercial facilities as well, and community facilities. Last thing is public policy. That's the fifth lever here, is you've got to have public policy that's really intentionally attempting to get at these gaps. So LISC is working on all of that. We definitely want to do it intensively with you in Buffalo, and I look forward to talking more about it. But I want to shout out to Julie and the local Buffalo team. I want to give a real shout out to the local members of our advisory committee who are volunteers and who are helping us. I have to also give a shout out to the Oshai Foundation, which has been a real incredible partner for us from long ago, and remain supportive of the work that we're trying to do. But closing these gaps, racial health, wealth, and opportunity gaps, are what we're all about, and we look forward to doing it with you in Buffalo. With that, Julie, I'll be quiet.
Thank you. And we're going to hold questions for just a minute, but I do invite everybody to answer in the chat, and we may be answering some questions in the chat throughout the dialogue. I'm going to turn things over to Tony Davis, who's with the Federal Reserve of New York.
Thank you, Julie. Can you hear me?
Yes, we can. Thumbs up.
Okay, perfect. So good afternoon, everyone. I am Tony Davis, and I'm the Community Affairs Officer for the Federal Reserve Bank of New York. I'm very pleased to be with you all today. I want to thank LISC and the other organizers of the event for inviting me today. Before I start my remarks, I have to note my disclaimer. Some of you are familiar with this from past events, but the views I express today are my own and do not necessarily represent those of the Federal Reserve Bank of New York or the Federal Reserve System. So just to give you all some context, the New York Fed's geography covers, of course, all of New York State. We also cover the northern half of New Jersey, Fairfield County, Connecticut, the US Virgin Islands, and Puerto Rico. So our district is actually the most diverse district throughout the Federal Reserve System in the country. Of course, I'm a little biased, but having those territories in the district is unique. I can definitely say that. As some of you know, we actually had a Buffalo branch for the New York Fed in downtown Buffalo for many years, up until 2008. And I actually started my career at the Buffalo branch. 2 years before the branch closed. So I have a lot of connections in Buffalo from back then and throughout the years as we've done programming in Western New York for many, many years. Next slide, please. Okay. So for much of 2020, our community development department went through a strategic planning process. The image on the screen right now does a great job of capturing the new strategic framework for our unit. For the sake of time, I'm not going to discuss all of the sections within the pyramid, but I do want to draw your attention to our goal at the top because it's the foundation of how we are organizing ourselves moving forward. Essentially, what we're trying to do is find ways to enable economic mobility for low and moderate income people, especially those facing poverty and structural disparities related to race and ethnicity. The second part of this goal, which is not listed on the pyramid, calls for us to educate, influence, and catalyze capital providers to invest in creating more opportunities for those groups. So as you can tell, the goal is not about marginal improvements, but it's really about supporting transformational shifts. Next slide, please. Thanks, Brittany. So the unit has identified 3 core themes for the next few years. We will focus our attention on the intersection between health and community development, mitigating climate risk related to low and moderate income communities, and we will focus our attention on household financial stability. The idea here for us is really to do fewer things than we have historically done with more intensity around themes that we can better communicate to result in greater impact. Poverty and structural disparities related to race and/or ethnicity are both a cause and consequence of poor health, which in turn is a key barrier to economic mobility. Most chronic disease is preventable. Most chronic disease happens to low-income people in low-income places. Nearly $1 trillion is spent annually in the US on chronic health conditions that stem from poverty and structural disparities. Moving forward at the Federal Reserve Bank of New York, we aim to redirect some of this $1 trillion to enable greater economic mobility and to help prevent chronic disease in the first place by addressing the social determinants of health that the speakers did a great job of outlining earlier in the day. Next slide, please. Okay, so our final slide here is a photo of a renovated home within the Family Village Initiative in Newark, New Jersey. This is an example of a partnership between RWJ Barnabas Health, New Jersey Community Capital, a community development financial institution that's based out of New Jersey, and JP Morgan Chase. In 2018, these partners, plus many other local partners, launched the Family Village Initiative, which is a comprehensive healthy homes initiative in Newark designed to improve individual and community health, housing affordability, educational attainment, and support service delivery. Through a $1 million investment from RWJ Barnabas Health, which was the first of its kind of a health institution for a redevelopment project within the community development lens, New Jersey Community Capital was able to leverage $15 million to rehabilitate 50 vacant and abandoned properties into 100 units of stable, affordable homes for families throughout New Jersey. So this concludes my portion of the presentation. So now I'll turn it back over to you, Julie.
Thank you. I'm managing chat and question responses simultaneously, so I appreciate the patience and apologize for the quick lag there. Tony, I'm going to stick with you for our first couple of questions, just as a bit of a transition. The region worked very heavily through the Regional Economic Development Council to identify strategic investment priorities where we might capitalize upon competitive advantages or assets in the community to help foster the next generation of economic activity. Can you speak about how COVID-19 has and may impact those strategies?
Sure, and this is a good question, but it's also a difficult question at the same time. I'll start by saying the investment priorities outlined by the Western New York Regional Economic Development Council are strategic and have a long horizon to achieve these investments. There's a lot of planning, research, and thought that went into identifying these strategic investments. However, we just don't know how long the pandemic will last. The longer COVID-19 goes on, the more some of these investment areas may need to be adjusted over time. And a good example of this point is tourism. Tourism may become a less relevant dimension of all economies, unfortunately, for me professionally and personally, as I love to travel the states and the world. But in the short and medium term, things might, or I should say highly likely, are going to look differently. For Western New York, a lot, of course, depends on what happens at the Canadian border in terms of travel restrictions. But overall, perhaps this means scaling back on expectations for tourism for the next couple of years or so. Now, as it relates for workforce development, which is one of the key areas of the strategy for Western New York, there's a need to put an emphasis on retraining workers without college degrees or in-demand skills. Conveniently, just yesterday, Chairman of the Federal Reserve Bank of of the Federal Reserve System, Jerome Powell, said, "We are recovering, but to a different economy." I think this is something we've all talked about, but this is something acknowledged at the highest levels of economics. The chairman went on to say it's likely that lower paid workers, as well as those in jobs requiring face-to-face interactions, such as retail or restaurant workers, will shoulder most of the burdens of this shift. These groups, heavily skewed towards people of color and women, have already been among the most affected by pandemic layoffs. And lastly, I'll just note, as it relates to advanced manufacturing, which is obviously huge for Buffalo and upstate New York in general, according to the Empire State Manufacturing Survey, which is conducted by a couple of longstanding colleagues of mine, even back from the Buffalo branch days, Rich Dietz and Jason Abel, the manufacturing sector is doing relatively well. Because people are consuming more goods right now relative to services. They see some parts of the manufacturing sector trying to hire workers, but they are having difficulty finding people with the right skills, which goes back to the need for retraining, doing a better job, or being more explicit about retraining workers, or even taking a step back to allude to what a couple of the first speakers were talking about, is looking at upstream determinants and really focusing on early childhood education so people are better prepared when opportunities present themselves.
Thank you, Tony. You gave me an excellent segue. LISC in 2020 launched our first Financial Opportunity Center in partnership with the Northland Workforce Training Center, which is, of course, focused around training community members to participate in the advanced manufacturing economy. Maurice, I'm wondering if you can talk a little bit more about the role of financial opportunity centers in that model and the powerful components of that particular system as part of a recovery strategy and addressing racial health and income and wealth equity.
Sure. So our financial opportunity centers, of which we have about 125 around the country right now, they do three things. Through a coaching model focused on underserved communities, focused on Black and brown communities, focused on individuals living in low wealth communities. We provide financial literacy, which basically is helping individuals develop budgets that show them what they have to do to become net cash positive, helping them to get on a pathway to improving their credit scores, or in a lot of cases, getting a credit score for the first time, really focusing on wrestling debts to the ground that folks need in order to raise their net income. So that financial literacy piece is one. The second piece is really helping individuals solve at least 3 problems that they need to solve in order to be great productive workers: housing, transportation, and childcare. And then the third piece is helping individuals acquire the skill sets, hard and soft, to get on a pathway to hopefully a post-secondary credential that opens up doors to living wage jobs and careers. These financial opportunity centers are at the heart of helping individuals holistically prepare for recovering and acquiring the kinds of jobs and the kinds of skill sets that one will need to work in a post-COVID America, a post-COVID Buffalo. It works. It basically focuses on the typical client is a client that comes in, an African-American lady who's head of household, who's raising children, who's also working. She has a GED or high school diploma. And when we test, she's somewhere between the 6th and 8th grade when it comes to literacy and numeracy skill sets. With hard work, in about 30 weeks' time, we can move that person from actually 6th to 8th grade competency to actually 10th grade competency, which is where we need to be to really get one eligible for some of the sort of post-secondary credentials that you need in healthcare or welding or something like that. These are real key strategies for helping individuals weather this storm and get prepared for an economy that requires new skills in order to get on a living wage path. So they are key strategies for recovering and repositioning to a post-COVID world.
Julie, you're muted. We didn't hear your question.
About that. Maurice, I get to reiterate. I believe that ProMedica is a health system in Ohio that has not only sponsored an FOC, but has also done the analysis to find that the financial and job supports you described realized improved health and reductions in healthcare costs. Can you say a bit more about that?
Absolutely. So ProMedica, which is the largest employer in Toledo, Ohio, and now one of the largest integrated healthcare systems in the country, now that they have purchased Paramount, which is a large senior care provider, we've actually collaborated with them to open up an FOC in Toledo. We opened up this FOC in the middle of what is essentially a food desert where there was no grocery store, amongst other things. We actually, by the way, paired an FOC with a grocery store. And yeah, what they are finding is they are literally preparing people from this community within Toledo for jobs within the hospital, medical technicians, amongst other things. And they're also seeing that financial literacy and improved access to healthy food and housing and skill sets that can garner livable wages is reducing the amount of unnecessary usage of their emergency room for things that people are now taking care of with a relationship with a primary care provider. So they are also seeing, so in addition to community benefits, they're seeing operational benefits for the hospital as well. I should further say that with respect to all of these financial opportunity centers, our key partners, in addition to the community organizations that we invest in to deliver these services, are the corporate partners that are investing their money into the operations of the financial opportunity centers, and they're partnering with us in order to help us prepare people for jobs that they need filled. And so it's a great partnership with the corporate community that needs to be extended.
Thank you. Tony, can you speak about how the region's racial, health, income, and wealth disparities may be affecting or impacting our economic competitiveness as we emerge from the current multiple recessions?
Sure. And this is indeed another challenging question, I must say. But, you know, I'd like to answer part of this question by citing a very timely report created by a couple of my colleagues within the community development team in New York, Claire Kramer Mills and Jessica Battisto. The report they created that was released back in July of this year is called Double Jeopardy, COVID-19's Concentrated Health and Wealth Effects in Black Communities. One key finding highlights volumes of COVID-19 cases coincide with Black-owned business locations. Data from counties all around the country show Black-owned firms are more likely to be located in COVID-19 spots, whereas white-owned firms are less likely to be in the most heavily affected spots at that time. As of June of this year, Erie County specifically had a relatively smaller share of Black-owned firms, as well as a lower case of COVID numbers compared to counties around the country. But of course, unfortunately, the COVID rate is rising really quickly in Western New York right now, as is the case with the majority of the country. Also related to this question, I like to briefly add, over the past few decades, upstate New York in general, not just Western New York, has had a hard time attracting people to the region for a variety of reasons. But moving forward, and I think many leaders know this, to be competitive, you have to do more with the untapped human capital in this region, more specifically within the city of Buffalo. And I suspect, and I grew up in a rural area, some of the rural outlying areas as well. And I think that the work of Employ Buffalo Niagara from the Buffalo Niagara Partnership is an important piece in addressing this issue.
Thank you, Tony. We are edging up on our time, but and Tony, you'll forgive me, but it's my pleasure to give Maurice the last word on this. Maurice, Maurice, you know,
Tony, I'm not sure why she would do that.
No idea. I think as we go into this, you know, a lot of people are facing a lot of uncertainty in their corporations and in the economy. There's a lot of uncertainty. Can you talk about the need to work at scale, or some of the very large scale, somewhat ambitious initiatives that are emerging despite the amount of risk and uncertainty that's in the marketplace right now? And the importance of working in a larger way.
Yeah. Look, the racial wealth, health, and opportunity gaps around the country are big. That's the first thing to be said. And to use a metaphor, we will not make any progress on them whatsoever if we play small ball. It's just, you know, this is not rocket science, right? Big challenges, long-standing challenges require bold, ambitious strategies. So we're in the Bay Area right now. The Bay Area is wrestling with a housing shortage in the affordability space that is ginormous. 500,000 units short of quality affordable housing for folks earning 80% of area median income or below. So what have we done? We have partnered with technology companies, with philanthropic companies, with Kaiser Permanente Hospital, with other CDFIs, with foundations throughout the Bay Area. And we've raised a $500 million fund for affordable housing that will last 18 years. The investors are sticking at it for 18 years, and it's $500 million. We can do that in Buffalo. We're in Charlotte. Charlotte confronts issues very similar to Buffalo: high segregation and a real undersupply of housing for folks who earn 30% of their area median income or below. What did Charlotte do? We brought together the government, the banks, the hospitals, the foundations, and we put together a $50 million fund from the private sector, combined it with a $50 million infusion in the Housing Trust Fund, and we're actually doing mixed income, mixed use projects in high opportunity areas in Charlotte. We're going to be working on it for the next 10 years. In Hampton Roads, Virginia, we've partnered with the largest hospital, Centera, and we've formed a $100 million social determinants of health fund that's going to work on housing, it's going to work on FOCs, it's going to work on food, access to food in underserved or food deserts. It's big, and it's going to be a 10-year project. The hospital is investing $50 million, and we're investing $50 million. The private sector is really stepping up to this moment, and we look forward to doing that with you in Buffalo. But this requires long-term, big, bold partnerships in order to really solve problems that we have seen in our communities for generations.
Thank you. Maurice, it's a pleasure. Sometimes we hear those large numbers, but it's actually very exciting. Already in my own short-term, career, it's getting longer. We as a region negotiated $1 billion NYPA relicensing settlement, which was followed not that long after by $1 billion Buffalo Billion initiative from the governor. And so it might be time to think about what the third iteration of that Buffalo Billion or regional billion investment is, and how it can really help us heal our community and our economy in a way that makes us resilient and strong and competitive going forward. With that, I'm going to turn it back to Rita for open discussion. I would like to ask both Maurice and Tony to stay with us for a few extra minutes. I know we do have some chat questions for you that we're trying to get resolved. But with that, I'm going to hand it over to my wonderful colleague, Rita Hubbard-Robinson.
Thank you so much, Julie. Thank you so much to our keynote speakers, our panelists. We just appreciate your time. Zoom is a beautiful thing because you didn't have to leave your house in order to be here with us. That's the upside. The downside is that we can't shake your hand. But so we'll give you a little Japanese salute, and thank you so much for your presentations. One of the things that comes to mind when we're talking about big ideas is that when there was an idea or a thought out there that the bills were going to be leaving, the business community came together. They came together and they said, no, we're going to come up with a solution. And that's kind of what we're talking about here. Our Pastor George talks about this in some of our meetings. How do we come together to make a big, bold change in our community? So with that, I'd like to spend a little bit of time with our discussion. One of our speakers, Dr. Tim Murphy, had a question that came up in our chat, and we thought, let's hear his voice a little early. He's also going to make some closing remarks. But why don't we just begin to chat amongst ourselves? We're asking if all of the participants here would be opened up so that we can have some verbal discourse. And so you're all going to notice the screen opening up and seeing more viewers and more participants in this space. So thank you so much for being with us, spending time with us. You can continue to use the chat if you prefer, but we are glad to see you all here. Look at all those wonderful names. If you want, you can let us see your faces too. So with that, Tim, what is your question?
Thank you, Rita, and thanks so much to the three speakers. This is really just outstanding. So my question, actually, I'm interested in both Maurice and Tony, your thoughts about this. The University of Buffalo is now investing in important ways to address health equity and racial equity, in particular by launching a Community Health Equity Research Institute. I'm interested in your thoughts, if you would talk to us a little bit about how you see partnerships with universities contributing to understanding the root causes of the social determinants of health, and then how we can contribute to mitigating and heading towards health equity.
Tony, you want to go first? Go ahead,
Sure.
Tony. I'll go after you.
Sure. So thank you for that question. That's a great question. And, I'll just briefly say that, universities all around the country, but especially in upstate New York and Western New York, are core anchor institutions. And so whatever they can do in terms of investing in these types of initiatives with hard dollars, and equally important, the research and analysis that they can bring to the table to help community organizations, philanthropic organizations, the public sector better understand these issues will be a nice contribution to advancing these types of issues forward.
Yeah, I would just add, we partner with universities all over the country, and we see them being investors in the work, particularly work that is impacting the communities right around them, their neighbors. And so we see them investing in housing. We see them investing in small business incubators. We, in Philly, the investors in the Financial Opportunity Center that is preparing people are the universities. In fact, they're not only preparing people, they're preparing them for work at the universities. In fact, the Penn and Drexel and Temple came together and formed a company that's hiring people from the FOCs to do landscaping and construction work at the university. So the universities are key, and plus you've got hiring, you've got procurement power. In my mind, the universities are some of the key anchor institutions to really, really do deep development work. And what we tend to do is to work with them to create the vehicles through which they can do that work, and that is consistent with what they're already trying to do anyhow. And obviously the research and the intelligence that you have as well. And universities with hospitals, even more powerful, because as I say, the social determinants of health work we're doing with mostly hospitals around the country. So I would tell you that if you look at the enterprises best positioned to really have impact in this, it is in fact universities that really want to leverage their anchor institution status for the benefit of the community. Would love to work with you on that.
Brittany, I want to just introduce Brittany. She's another one of the team members here. She's a great person. She started her work here in Buffalo at the University of Buffalo, and now she is also a member of the LISC team, but she's been a team member here with us planning this event. She's going to help me with some of the questions. Brittany, do you have any questions in the chat?
Thanks, Rita. We had a question come from Joe Fritz from Dent Neurologic about early childhood education and root causes. And Julia Ryan from LISC's Health Initiatives has addressed the question in the Q&A box. But I invite Joe to ask for any additional clarification or If you have any additional questions, and anyone to come off mute, we're now all in the room. You can ask your questions here in this space. We have time for a few more with our guests.
Oh, thank you. Can you hear me okay?
Yes, Joe, thanks.
Yeah, no, thank you very much for the answer. We understand all of what can and should be done in the current generation, but we also know that there are teachers that often find that some of the difficulties in the next generation coming up are because the environment in which the kids are growing up isn't necessarily as supportive in some sense for whatever reason as generations that have been able to have, you know, generation after generation for some time have successful offspring. So some form of not only better schools and better education, but the opportunity to allow these kids to also have some kind of support for the family infrastructure that can help them to develop the role models, the work ethic, those other types of things that become more than just the didactics, and wondering what ways that businesses might be able to support those types of initiatives, including ways in which maybe the kids can come in and precept and develop role models by seeing real work in action and get some excitement at an early point in life. But understanding what models might already exist and how we might be able to develop those locally would be of great interest to us.
Great. Thank you so much for your question and your follow-up comment. I think Dr. Underwood wanted to weigh in.
Yes, we have a multi-level problem. One is a problem that you outlined, and that we have people who have been left out of the marketplace of education, and therefore they don't have the skills and the resources to be able to help their children at home navigate through the educational system. We also have an educational system that, to be honest, is somewhat hostile to Blacks, right, to young students. And there's numerous of literature there to support that. The question is, how do we begin to do what Maurice and others have said, begin to look at this in a structural way to say, how do we enhance our human capital, right? Number one, here's some ideas, and again, it's thinking through truly. We can do things like adopt schools. We can use industry and capital that are looking to develop engineers, architects, scientists, people to just answer the phones, that they come involved in the school system and they basically help the schools understand that that student that's there has capital to deliver to society. Second, as some of the other programs that were talked about that enhance people's lives who are currently out of the workforce, forced to bring them into them, or they're in the workforce and they go from grade level 6 to 8 to grade level 10 and beyond, those individuals, and they have professional development programs as well, that transforms to their children.
Thank you.
If there be no other questions, I think we're going to move to a video to introduce the next section of our event, which is final steps for today. Again, thank you so much to our keynotes, our panelists, and we are just so grateful to have such wonderful abilities, I would say. Our superpowers are showing up with the participation of both Maurice Jones and Tony Davis. Thank you both so much. And thank you for your questions up to this point. And we're going to wrap up our day in the next few minutes. Thank you again.
Poverty is a real factor in a person's health. And we find that there's such a disproportionate amount of African Americans in our community on the east side of Buffalo that are struggling with health problems. They're going to live about 12 years less than whites who live in other communities. For children, 3 or 4 times more likely to have asthma. African American women, less likely to have breast cancer, but more likely to die of breast cancer. All the medical science is showing us, and the data is showing us, that it's the social determinants of health. It's the living environment. It's the economic situation. It's the access to quality education. It's the access to fresh fruits and vegetables. And all these things are a real problem in our community.
There is diabetes in my family. There is heart disease in my family. This is my history. And doing research, medical research, can help with this.
UB has long been committed to engaging with our local communities to build a stronger, more prosperous region. This includes our commitment to help improve the health and well-being of our neighbors.
The mission of the UB Community Health Equity Research Institute is to perform research to understand the root causes of health disparities and also to develop and test innovative solutions to address these pressing problems in our community.
My doctor said that I'm her first patient that has done this research, and I was a success. It's also a learning experience for me.
The Institute will bring together the power and the expertise and the scholarly activity of the university from multiple disciplines. It includes addressing poverty, education, food deserts, access to health care. We have 10 or 12 schools involved at this point in the Institute, including architecture and planning, medicine, nursing, public health, management, school of law, and others.
This institute is founded on principles of social justice. We believe that health and wellness should be realities across all neighborhoods, across all zip codes.
And what a great story it would be to tell about Buffalo, about how we developed our waterfront. We developed this world-class medical campus right in the inner city, and we eliminated race-based health disparities in our community.
We have some unique approaches in Buffalo, and we have talent and expertise in Buffalo where we have an opportunity to become national leaders in this area.
Now, without further ado, I'd like to introduce the next two speakers. Dr. Tim Murphy, who is the director of the UB Community Health Equity Research, and also Pastor George Nicholas, who is the convener of the African American Health Equity Task Force. Thank you so much.
Thank you, Rita.
And thank everyone for attending today. This has been just a great session, and it's encouraging to see the business leaders and the leaders in our community that are here and committed to understanding and addressing these problems. So the video introduced in many ways the beginnings of a university commitment to community health equity. And what I'd like to do is just very briefly, in 2 minutes or so, talk about next steps. And so maybe next slide to show those 3 next steps. So one is we're asking you to initiate leadership conversations in your companies, in your organizations, to talk about strategic investments and planning options that center health and wealth and race equity. So not just because it's the right thing to do, but it'll impact positively the bottom line. And I can tell you that the university is on the same journey with you. We're asking you to join. We are having important conversations internally and with our community partners. And those are the conversations that actually led to the launching of this institute. And I applaud university leadership, President Tripathi and Provost Scott Weber, and the leadership in investing real dollars in doing this, making this commitment of university resources to our community, and particularly our community, as Marie said, that literally surrounds our Buffalo Niagara Medical Campus. And we'd also like you to reflect on how your current activities impact the quality of life and the social determinants of health in Buffalo, particularly the African American communities in Buffalo. And so our journey in the Institute really is changing how we do research by placing a priority in 2 areas. One is partnering with the community in our research. That the community will guide our research agenda and participating in performing the research. And then the second is to do research with a goal to benefit the community. I think our investigators have done that sporadically and on an ad hoc basis, and now we want to educate our researchers to have that approach of community-based participatory research high up in their priorities. And then we ask you to get together with your peers to talk about large-scale strategies. And again, Maurice said it as well, that we can't keep doing the same thing because it's not working. We need new ideas and big ideas and bold ideas. And that's what I think we all need to do. So I'd like to thank each of you for joining us today. And on behalf of the University of Buffalo, the Community Health Equity Research Institute is ready and enthusiastic about working with you in making these kinds of fundamental institutional changes that we need to advance health equity and racial equity in our region. Thanks, Rita.
Thank you. Thank you, Dr. Murphy, and thank you for our partnership that we have developed. And I got 1 minute, so that's what we're going to do. Our next steps, you can go to the next slide. We don't have time to share this one, but go to the slide that talks about our next steps. We are calling on you to do those 3 things that Dr. Murphy had laid out, have these conversations, and then we will come together again on Friday, January 15th at 11 a.m. To have a more of a conversation with you about these issues. There's 3 things that we're willing to do: convene, facilitate, and lead. And so we have these 4 groups that have come together, LIST, the University Population Health Collaborative, and the Buffalo Center for Health Equity. And we will provide the facilitation, the convening, and the leadership to begin to start formulating an approach that will be transformative and that will eliminate race-based health inequity within our community. If you look, once we send this list out to you, if we come together and stay together and work together, we will be absolutely successful in any endeavor that we do. I'm not trying to take shots of other activities that have happened in the past, but if we're honest with ourselves, we know that the situation in Black Buffalo has not gotten significantly better over the past 25 or 30 years. The data shows that. And so we have to work smarter. And I think we have to work across generational and racial and class lines and begin to start solving these problems. There is good news. Because of the work that we've been doing with the Buffalo Center for Health Equity during the COVID-19 and the COVID-19 response, Buffalo is one of the few cities in the United States of America that does not have a disproportionate number of Black people who are dying as a result of COVID-19. That's 100% related to the coalition and the collaborative and the relationship building work that we have done over these last 5 or 6 months. So we will continue to be reaching out to you. We thank you for spending this afternoon with us, and I'm going to pass it back to Rita, and she will and John, so we'll close this out. So please mark on your calendars Friday, January 15th. Please read the briefing book, share it with others, talk with others within your circles, and we are committed to doing this work, and we're hoping and we're inviting you to join us in this as well. Thank you again.
Thank you so much to Pastor George and to Dr. Murphy for your leadership. You're just awesome to work with, and I really appreciate everything that you do. At this time, we're just going to ask John to close us out. We thank him for his leadership and the work of the Population Health Collaborative, Live Well West New York, Buffalo Center for Health Equity, LIST West New York, and the UB Community Health Equity Research Institute. Thank you again for allowing me to moderate this program for you. Have a great day and a wonderful weekend.
And thank you, Rita. Thank you, everyone, for joining us. This has been terrific. It is 1:31. I will be less than a minute, I promise. Housekeeping is important because we are going to follow up. Everybody on this call will get, or on this Zoom will get the slides, a recording, a list of the participants, but the list of participants is also in your briefing book. So please look at that briefing book. There's a real wealth of information there. We also know that a lot of you have not used your Grubhub gift certificates. It's you know, an Orwellian world now, so we know not only whether you do it or not, but what you eat. So Don Ingalls creme brulee, really? No, we don't really know that. But use those, and when you use those, convene other people. Take people to lunch with you and talk about what you've heard today. And when you come back on the 15th, bring some colleagues, bring some peers, bring some other people to the table who need to know about this important work. So stay healthy, enjoy your weekend, and we will see you all and other people back on January 15th. Thanks so much, everyone.